It was a great question at the end about what can we do, and Professor Haynes' answer was we also need to do some positive messages. So I'm going to try and do one of those positive messages, but I want to put it in context. Look, this isn't a silver bullet. You've already heard, and most of you will know, many of the challenges we already face. So I'm not saying this is the answer to everything, but this is something that we could do, something that we are doing, something that Vienna actually is well leading in, that could be used across the world to the extent that urban nature, I mean, Andy mentioned natural environments, urban nature can mitigate the health threats of climate change. And I'm going to talk a little bit about some of the evidence that would support that statement going forwards. There's a quick overview. I've got 15 minutes, so I'm not going to spend any long details on the slides. And if you want to follow up on some of the data that I present afterwards, I'm happy to talk about it. So what about urban nature and health? Well, I mean, in the bigger picture of things, of course, there's many determinants of health, all the way back from genetics through to lifestyle factors you'll be familiar with, diet, physical activity. Andy mentioned all of these. We're particularly interested in the stuff out here on the distal dimensions of climate change. But my research and the research of people like me as an environmental psychologist looks at the way we interact with our built environment, with our natural environment, how that interacts with global ecosystems to ultimately filter down through to the health impacts that are being impacted by climate change. So how would urban nature promote health? This model has been around for a decade. It's extremely well supported by thousands of studies around the world now. Basically, and it touches on many things that Andy's already said. The natural environment can improve air quality by reducing pathogens. It can increase physical activity. People exercise, for example, in parks. It can increase social contacts and social networks. It improves neighbourhood well-being, and they can reduce stress. All of those things, there is a wealth of data to show that that can promote health and well-being. And he also talked about the importance of preventive medicine. So let's keep people as healthy as possible for as long as possible, because healthier people are more resilient in terms of biopsychosocial resilience processes to the challenges that we're going to face under climate change. So what I'm going to talk about today is, yes, we can support specific vulnerable individuals through urban nature, but also making our urban settings more natural and building greater connections between urban populations and the natural world can have many spin-off benefits. Like I said, there's been thousands of studies done. We've just completed an 18-country study which used all of these in a single model and shows that all of these pathways are actually singly predictive. Andy mentioned at the end with Life Saved, many of these things co-occur. What you also see is they do occur, but they're also important in their own right separately. The first thing many of you will have come across is something called nature-based solutions. These are the big ticket things that the WHO, for example, and the United Nations is really looking to work around with cities to help reduce some of the challenges faced by climate resilience. If you're not familiar with the term, the International Union of Conservation of Nature define it as actions to protect, sustainably manage, and restore natural and modified ecosystems that address societal challenges such as climate change, effectively and adaptively, simultaneously providing human well-being and biodiversity benefits. It can be quite wild environments, for example, forests, wetlands, coral reefs, and mangroves. For today, I'm going to be concentrating on more urban settings, such as street trees, green roofs, and so on. So you heard a lot about heat. You heard a lot about, I'm sure, urban heat island effects. I mean, if you just look at Vienna, there's a 3 to 4 degree difference between people who live in some of the areas in the 14th district, out near the Wienerwald, and in the 1st district. Vienna has actually got a fantastically, in my opinion, fantastically well-developed urban heat island strategy. And when they've systematically reviewed many things that could be done in Vienna to challenge and to at least mitigate or adapt to some of the challenges that we're going to be facing over the next 20, 30 years. Of course, you'll recognise the Wienerwald here as a cooler area, gradually getting hotter. That's partly to do with the wind direction. And Vienna is suggesting many ways of trying to tackle this through all kinds of urban greening plans, all kinds of community greening schemes, but these are quite micro. The actual impact any one of these is going to have on climate in Vienna are very minimal, but Vienna is very, very good at looking at a systematic, integrated plan, looking at the way wind moves through. Where is the best optimal place to plant trees? Where is the downwind benefits going to come? And over the next 50 years or so, the next 5 to 10 years or so, I think Vienna is making real progress and as one of these nature-based solutions in terms of greening. Another thing that Andy mentioned under climate change is extreme weather events, and of course that's often associated with flooding. We're obviously at a very high flood risk here in Vienna, for example, and there are very, very detailed risk management plans both in Vienna and across Austria, again, to try and mitigate these kind of things. In fact, Austria was about 50 years ahead of the curve. You only have to look just across there to notice one of the earliest nature-based solutions impacted that's had a major, major impact on us. In 1972, the Donau Insel looked like this, i.e. it wasn't an insel at all, as you'll know. Then that area was dug out, this was rebuilt, and it looks like that today, of course. That's been a 50-year process. Now, the main reason for doing that was to reduce the flood risk of Vienna. This was before climate change was really on the agenda. The other really interesting thing about this in 1972 was to make this place an area of recreation for the city dwellers, especially if you think about the second, first districts. There's very little green space. So actually, even in 1972, people were saying this is important for people's health, not just because it prevents the flooding, but because it offers an opportunity for recreation. And it's that I want to turn to next, because, okay, we can use nature to keep people cooler, to keep people from avoiding floods under climate change, but we can also use it to encourage them to recreate more in these environments, and that is very good for building their health and very good for building their resilience, because people aren't corals. Coral can't move, so when the temperature of the ocean increases, you understand about these coral bleaching events where the coral expels the microalgae that inhabit it to try and protect itself. People aren't just reacting to climate change. So an older person isn't just sitting there going, oh my God, it's hot. They have the opportunity to do behaviours. And as a psychologist, I'm really fascinated in how can we act, given the changes that are going on, to get out into natural environments to help these processes. And of course, we're also particularly interested in vulnerable communities and how can we support those individuals access that. And again, as a psychologist, those social networks and support systems to be able to adapt to climate change, the climate change that's happening is crucial, because we're not corals, we can do something about this. So if you look at nature-based recreation, this is work we did with the Department of Environment in the UK, DEFRA. We looked at 20,000 adults and we were looking at their health at the top and their well-being as a function of how long they spend, to try and give doctors an indication of how much time you should prescribe to spend in nature. To cut a long story short, it's about 2 hours a week, and now in Canada, for example, over 10,000 GPs in Canada now prescribe people 120 minutes in the natural environment. Based upon this research, you'll see the curve goes down, and you're probably wondering, well, why is that? Why is spending more time in nature banking? Partly that's to do with who's doing this. What we find is people with clinical anxiety actually spend the most time in natural environments. This is recreational, so we don't think it's causing their anxiety. We're thinking people, large numbers of the population, remember a quarter of the population at some point will experience a common mental health disorder, for example, depression or anxiety. People are already using nature to self-medicate to some extent. And in the UK, this data is in the UK, of course it rains most of the time in the winter, so dog walking in January is not so much fun, you have to do it. That might also decrease. But the main point I want to make is the vast majority of the population is here, and they could benefit from spending more time in the recreation. But that was only in the UK. More recently, we've looked at these kind of relationships in 18 different countries around the world. Each dog is a person, we know where they live. We've been looking at factors such as what activities they're doing, their health, what the climate is happening in different events that they're experiencing. And to cut a long story short, we see this pattern of higher well-being. This is the World Health Organization metrics of well-being here on the vertical axis. The more time you spend in green spaces, the more time you spend in blue spaces, the higher the well-being, both at the individual level and the country level. So someone like Hong Kong in the UK doesn't spend very long in nature, their well-being is lower. Countries such as Portugal, Spain, Greece and Bulgaria spend more time there, their well-being tends to be higher. What does that mean for climate change? Well, again, we worked with the Met Office to look at 47,000 visits in the UK, and we looked at the climatic conditions under which people visit nature. What were they doing, particularly how much physical activity they were doing, because we know that the amount of physical activity you do provides a number of health benefits. And then we modelled what they were doing, what they might be doing under different climate scenarios, and to cut a long story short, in the UK, as it gets warmer and drier, people are going to go out more, they're going to exercise more. And this is a counterintuitive message. This is one of the few areas where actually climate change in the UK could provide some health benefits. That does not mean they outweigh the health costs, and I'm not saying that at all. But we need to be honest about where are the benefits that we need to grasp, and build on. Of course, as is kind of obvious, especially since I moved here to Vienna, as soon as it gets hot, people want to go to blue spaces and water. So somewhere like the Gänseweifel, when it's 32 degrees, is absolutely crowded. How do we, as a society and urban planners, support the population access those blue spaces? Maybe make more of them. Improve the public transport network to support the more vulnerable people get to these places as the temperature increases. And that's the important bit about vulnerable populations. What we do know is green space helps mitigate the inequalities between rich and poor. So our original 18-country study didn't have Austria included. So when we moved here 2 or 3 years ago, we started to collect what we think is the first representative sample in Austria, 2,500 people across all 9 Bundesländer, about what they're doing in these spaces and how could that impact on their health. And one of the key take-home messages, if you don't remember any other slides from today, this is the one I'd love you to take home. Along the bottom here, we've got the income. It's equivalized income. It takes into account how many earners there are, how many children in the household. And here we have low income, and here we have high income. And we've got different well-being metrics here on the vertical. It doesn't matter so much. This is an emotion-related one. This is a cognition-related one. But what I want to show you here is these lines represent the amount of green space around your home. We all know, for example, in the 10th district, there may be a lot less green space than somewhere like the 18th district, for example. What we see here is richer people have higher well-being. Richer people are also healthier, right? It doesn't actually matter in Austria how much green space is around your home. You're going to be happier, you're going to be healthier anyway. When you look at the amount of visits you take to recreation, a really important thing happens. What we see here is, if you're rich, it doesn't matter how much time you spend in these green and blue spaces. If you're poor, it matters an awful lot. So when you look at the upper distribution of the poorest in Austria, their health and well-being is significantly higher if they're using these natural environments to promote their own health. So in other words, improvement of our urban cities to make them greener, to bluer, to support poorer populations' access to this, can reduce this health gap between rich and poor. And we think that's probably a really important thing, especially because climate change will affect the poorest the most. This does tie in with global urban nature targets. If you look at the sustainability goals, particularly related to cities, number 11, 11.7 is to provide access to safe and inclusive green spaces and parks for particularly vulnerable populations. Very few cities are meeting the grade here of up to 40 to 50%. Vienna's not doing too bad at all. There is a reason that we're number 1 city in the world, according to The Economist, to live in terms of livability. 31%, actually when you're also adding the blue spaces as well, you can add 10% to that. So we're nearly there, we're on the 40 to 50 cusp. That doesn't mean we need to get complacent, it's about how can we improve access for the most vulnerable to those situations. The WHO, of course, also talks not just about greening our cities, but getting access to it for the most vulnerable populations. And Andy also mentioned about the importance of biodiversity. So the Convention on Biological Diversity also says, interestingly, it's crucial to get people to these natural spaces, and I'll tell you why that's really important shortly, after I've just talked briefly about therapies. So therapies is much more, rather than looking at populations, it's about taking clinical groups and particular groups in need and how can we support them through the urban natural environment. I'm just going to touch upon a brand new project we're leading here at the University of Vienna. It's in collaboration with the UK's Research and Innovation Award scheme, and it's called Resonate, and we're particularly looking at how resilience can be built within more deprived communities through access to urban nature. And we take a basic prevention pyramid approach, where this is whole populations, these would be at-risk groups, and here is people with existing conditions. And when I talked about nature-based solutions, urban greening, we talked about the Donauinsel, these can benefit large numbers of the population, right? But these people, this is a preventive health measure, for example, to get them to do more physical activity and so on. What we're really interested in this project are level 2 and level 3, where we're using nature-based therapies, nature-based social prescribing. You might have been familiar with green or blue care. In fact, Austria has been running one of the world's leading green care projects for the last 10 years, seemingly unnoticed. I'm amazed at that's why my passion is, right? But very few people know this. There are hundreds of farms in Austria that support people with various mental and physical health conditions through green care, through based farming, that's shown enormous economic return, coming back to the economics of this. And we're looking at a range of these schemes in this project across Europe. We're working across 14 European countries, and we're linked in with Australia, America, and Canada, and we're trying to get a global handle on how best to use these schemes for the most vulnerable. I'm not going to go through this diagram because this is the one we're looking at, how nature can build resilience. The point I just want to make before wrapping up is that there are various sources of stress. Climate change is one source of stress. Nature-based solutions, such as the Dornow incident, can reduce the amount of stress populations experience, for example, lack of flooding or lower urban heat island effects. But nature can also build biopsychosocial resilience amongst individuals in order to be able to adapt to climate change. And I'm happy to talk about the processes more if you're interested. What's important is in the UK, we now have got something called nature on prescription. So doctors, like in Canada, are allowed to prescribe people, particularly with chronic illnesses that are very hard to treat with classical medications. Often they've got comorbidities. By saying you can do different things. This process is called social prescribing. It could be art therapy, it could be cooking therapy. Nature therapy is one of a number of social prescriptions. It works by the doctor in consultation with the patient saying, look, I can only go so much to support your health. Are there other things in life that might be good for you? Particularly loneliness is a classic related to poor health. Joining these groups, giving the doctors support and legitimisation of these processes have been shown in the UK to have significant improvements on some of the most vulnerable in the country, in the UK. And I'm delighted to say that in Austria, this is also now being rolled out. So some of you might know Daniela Rodatz and her team in the Gesundheit Österreich. So the new, interestingly, it's called social prescribing here as well. There's not yet a German/Austrian term for this. So they're going through these processes. Slightly unfortunately for me, nature-based therapy isn't one, but we're going to be working with Daniela and her colleagues to try and get nature embedded with these other kinds of processes. And finally, just to wrap up, and this is an important point about not just adaptation, but mitigation. Urban nature can help reconnect us with the natural world that many of us are disconnected with. In the UK, 80% of people live in urban settings. Here, it's about 50%, right? But nevertheless, there's a very strong showing that people who live in urban environments value nature less. They feel less connected to nature, and that has implications for protection of nature, for climate change, and for health. So nature connectedness is an incredibly simple concept, actually, and it can be shown like this. So I could ask you, where do you see yourself in these pictures? Do you see yourself as the kind of person that's completely detached with nature? You kind of overlap with nature, but not so much. Or do you see yourself completely embedded? Are you 100% feel like that? And you think, wow, what can that tell us? Actually, it can tell us an awful lot. So this, for example, is a meta-analysis of 37 different studies with 13,000 people. Some of this is cross-sectional, some of it's experimental. The correlation between how connected you feel with the natural environment and your pro-environmental behaviours, including observable behaviours, is by social science standards, 0.42, very large. It means it's explaining about 18% of the variance in our pro-environmental behaviours by how connected we are. Therefore, if we want to promote pro-environmental behaviour, we need to promote nature connectedness. And connecting people who live in urban environments with nature is a crucial step in that process. Sorry for the next slide, don't worry too much about the numbers, this is work in process. This is Austrian data, again, using that representative sample. But what we did was we look at recall, albeit, the exposure you had in childhood, your nature connectedness in adulthood, and your pro-environmental behaviours in adulthood. And to cut a long story short, those people who spend more time in nature, this is Austrians, right? Those Austrians who spend more time in nature as a child feel more connected as an adult. They spend more time visiting these places in adult. And crucially for climate change, they're more likely to engage in a whole range of pro-environmental behaviours in terms of energy reduction, transport choices, and so on and so forth. So spending time in these natural environments, especially these urban environments, can build this connectedness in the young that maintains through our adulthood. Some countries are doing this better than others. So here we've got well-being, and here's nature connectedness as a function of country. Austria, by the way, is about here, halfway up. The UK, I'm afraid to say, is very low down. As is Hong Kong, California, Queensland, Australia, Ireland, and Canada. You might notice a common theme with our 6 lowest countries in terms of nature connectedness. It's the UK and former, dare I say it, UK colonies. Why might that be? And that's obviously a bigger issue than we've got and can deal with today. But I wonder if there's a legacy of early industrialisation of the UK and colonialisation, which was largely focused around resource extraction and a certain attitude towards the natural environment that many other people don't necessarily. Okay, Spain had its own colonies, right? But we shouldn't necessarily assume, the British amongst us, that everybody else has a similar attitude to nature to us. Okay, take-home messages. The point Andy was making is that we've got many, many challenges. This isn't going to solve all of them, but this is one part of the solution that we can potentially do to improve our health outlook under what's going to come, is some pretty bad climate change. Urban nature can mitigate the effects of climate change on health via nature-based solutions, urban greening, flood management. It can promote protective behaviours, health protective behaviours, and it can build biopsychosocial resilience for what's coming, and I can talk much more detail about that if you're interested. Crucial for me is it can support underserved and more vulnerable individuals and communities, both by offering them the chance to access these places so they can self-medicate, but also how can we support some of the most vulnerable access these places? How can we make it part of the medical care system where doctors relieve some of the burden on them and actually improve the patient's lives by saying, let's support you get to these places? And finally, if we can rebuild the nature connectedness that many of us have lost, then that can promote the kind of pro-environmental behaviours that we need to tackle environmental change. And with that, I'd say vielen Dank für Ihre Aufmerksamkeit.